You could join us. I want to now speak to Florence Mature, gender and child protection expert. Just a quick reaction on the story of the teenage pregnancies crisis in the country right now as a result of COVID-19. Florence, thank you for joining us. Looking at that story, let's get your initial reactions to some of the stories we've had from those girls.
Unfortunately, Akisa, these are cases that are reflecting the whole country. I don't think there's any county that can say that during the pandemic, there were no violation of children. You do remember when we went into the first lockdown in March, the one who sounded an alarm was actually the ODPP when he said he's receiving a lot of cases, defilement cases. And as you can see from the result, the ones who bear the brunt are the young girls, because then they end up pregnant and having to curtail their education. And we have yet not to see the magnitude of just what COVID has done to our young children. And this is just a tip of the iceberg.
Likely to see, considering we're dealing with a third wave and we are seeing lockdowns in 5 counties, I mean, what are we likely to see?
Actually, Akisa, I mean, immediately the president issued his statement on Friday 26th. My initial reaction was there was no clarity around protection. There was no clarity around if somebody is violated, what will they do? Remember, if we were to learn anything from the first lockdown, there was an increase in violations. What was the government going to do in this case, now that there is another lockdown? Around A, protection, and B, response to people who will be violated, and in this case, children. And I know the government will say we have 1195 number for people to call, but you can see these children. You see the 15-year-old being lured because we have no safety nets. You know, before, in the last lockdown, there were at least some provision, you know, for people who are not able to work, and many people have lost their jobs. And you see perpetrators taking advantage of young girls and violating them and leaving them with the burden of the emotional trauma, physical trauma, and of course having to raise children when they themselves are children. So in this next wave, because we even don't have safety nets, we have not given directives of how people can be protected or be responded to when there are violations, I think it's going to be worse. And again, this is the time that also schools are closed. We have a 7-week break, and also for the, you know, when the Form 4s, Class 8s, when they finish, there's also a long break. What are the measures that government are putting in place to ensure that A, our children are protected, but B, we are able to respond when there is a violation? And Akisa, you remember,
yes,
in the first instance, we had the National Crime and Research Center. The president in July said, we want to find out who is making our children pregnant,
yes,
who is violating our children. The report came out. What have we learned from that report? What has government done based on that report to ensure that this does not happen again? I know of a county that had 7,000 pregnant girls. Akisa, 7,000 is like 7 primary schools. If that is not sounding an alarm, if that is not shocking to us, yes, I don't know what will shock us.
Florence, what do we expect to see the government do? We have been doing these stories. The information is out there about the numbers. What should be done right now to avoid the crisis worsening?
So in the last pandemic, we had one county respond positively and put a safe house for people who are at risk of being violated, and that is Makueni County. We were hoping that then this can be accelerated to other counties so that we have safe spaces for children, but also for anybody who is at risk of being abused.
Right.
And because we're talking about children, we also know, I remember one of the ladies that you interviewed was saying that some children are abused by their fathers.
Yes.
So you can imagine a child who is at risk in their own home, where can they go?
Okay.
And for me, the trumpet sound I'm sounding is, can we have safe houses so that children who are at risk can at least be safe?
Right.
And be protected, so that we don't wait until they are violated to do something. Number two, can we have directives? Because in these 5 counties, the curfew is at 8 p.m. If somebody is violated, or if a child is at risk and they're running away, how do they pass through after 8 p.m.? How do they get to the police station? How do they get to the hospital? What measures will the government do? In the last pandemic, there was something within Nairobi to at least assist people to access help.
Florence, in under a minute, if we let this go unhandled or unaddressed, what are we likely to deal with in the near future?
Oh my gosh, we're going to deal with children who are traumatized. We're going to deal with a society that is angry, because if a child is violated and we as a society are just watching and doing nothing, you can imagine the adults will be raising. Children who will be angry with the state, children will be angry with the society for doing absolutely nothing.
Florence,
that is what we are likely to see.
Thank you very much for speaking to us. We will continue to follow up on these stories and perhaps see how the government reacts to this. Florence Machio is a gender and child protection expert, just reacting to that special report we've just run on the crisis that is teenage pregnancies across the country and physical and sexual abuse. I want us to take another break. You're watching KTN Prime. When we get back, sports news.